What are the side effects of preventative chemotherapy? You see, I'm certain that after the COVID vaccinations, there's going to be a lot of people with cancer or what they're told is cancer. And now the public are being prepared for this using celebrities, sports personalities, and the royal family as vectors for this campaign. And obviously, a lot of people are going to be offered chemotherapy, which is apparently going to help them. But look at these side effects: nausea, fatigue, hair loss, nerve pain, diarrhea or constipation, which are completely different, low red blood cell count, brain fog, skin changes, nail changes, mouth sores. And apparently, all this could last just a few weeks or continue as long as 10 years. So, what I'm saying is, if, first of all, unless you really feel ill, don't go to the doctor, because the doctor will probably find something wrong with you in much the same way as if you take your car to have an MOT, they quite often find something wrong with it. Sometimes there's nothing wrong with it, but they want to make some money. Look at this list of so-called side effects. These things, even one of them, fatigue, hair loss, nerve pain, diarrhea, constipation, many of these things would make your life unlivable. Can you imagine having all of them at the same time? You'd want to kill yourself, right? So is it worth getting treated in this way with chemotherapy? Chemotherapy itself might have long-term harm. And of course, there's no guarantee that the diagnosis was correct. I mean, are they asking you about your lifestyle? Are you sleeping well? Are you doing enough exercise? Are you getting enough fresh air and sunshine? Do you have anxiety in your life? Obviously, if you have good food, you do regular exercise, you have a good diet, you get out and about, you've got hobbies and interests, you've got a loving family and enjoy how to have a laugh and good time, I would say you're less likely to be ill. But if you keep going to the doctor with endless ailments and demanding medications of all descriptions and being injected for things that, with substances you know nothing about, for something that frankly wouldn't have been that serious. So in my opinion, the narrative, because don't forget, Kate and William recommended vaccinations. And they said, at the same time as they recommended it, we are by no means medical experts. Can you imagine that? Can you imagine advising somebody to be medicated and telling people at the same time that you're not a medical expert? You're not allowed to give medical advice unless you're qualified. I mean, these people, a lot of them, even qualified people, give false medical advice because they're paid to do so. But the royal family, should they have been trying to persuade gullible, moronic British people? And there are a lot of us around. I'm not one of them, but my compatriots are a bloody disgrace mostly. Should they have been advised to take a medication? The answer is I don't think so. I think they should have kept out of it. It's not their job to. And I mean, local councils, local politicians, Alan Shearer, you name it, they were all recommending vaccinations. They had no reason to do that. Should they be held liable for any side effects you have? I mean, the side effects are worse than, what is the point of getting all these different things if in order to avoid, a runny nose? Diarrhea or constipation? Maybe you get both at the same time. Who knows? So I think we should avoid, I think medical advice has to be from a trusted source, and we need to be very suspicious because people are being paid to give advice. It's not really advice, is it, if you're being paid? I mean, for example, if I was a Coca-Cola rep and I went to your shop to try to sell you to Coca-Cola, would it not? Would you not think, this guy is going to tell us that Coke's the best drink, isn't he? You wouldn't say, well, he's an expert, so I'm going to buy Coke. How about checking some other drinks on the market, or maybe have none at all, maybe just drink water? right? So for sure, in my view, in your view is different. Of course, the problem with all my videos is, first of all, they get seen by almost no one, including people who used to follow me, don't even know where I am or how to find me, or even that I exist. But also the people who really should be listening to this type of content, not me in particular, but people who are skeptical, people who are critical thinkers, people who can see the big picture, who can join the dots, they are not seeing this content. The only content they get is from the mass media, from the newspapers, and the newspapers are deceiving them. But the problem is, if you do try and talk to them, most of them wouldn't be willing to listen because they even though you're not being paid, they'd actually rather trust someone who's being paid, because we live in a very status conscious society. If you have a good job or if you're famous, people will listen to you. That's why, even though Kate and I mean, I mean, so okay. Well, anyway, I mean, the video of Kate speaking was artificial, and so the fact is that any conspiracy theories that are out there are completely the fault of the royal family. If they want to put our minds at ease, then that's not the way forward. That's not how you do it, because they're presenting us with Photoshop imagery, AI imagery, fake narratives. I mean, they were telling us she wants to be quiet and wants to live alone. He wants to be. And then a few days ago, there was a picture of her going to the farm shop, and some man with a Portuguese name pretended he'd seen her. Right? Do you think the people in the farm shop might have noticed? Hey, I'll have some bread. Who's that? Oh, I don't know. Looks sort of familiar. Not sure really. you know, there would have been crowds of people if they'd seen them at Windsor Farm Shop. For fuck's sake, what a load of bollocks. Thanks for your time.